Whether you suffered from diabetes yourself or know a friend or a loved one that does, understanding type 2 diabetes causes and what can be done empowers you when making educated decisions about your or your loved one's care. Although the exact mechanisms that lead to this disease are unknown, there are direct links to obesity and lack of exercise in one's life to the development of type 2 diabetes. Type 2 diabetes causes are either based on the pancreas not producing enough insulin or the fact that the cells in the body no longer recognize the insulin that is produced by the pancreas. Insulin is an integral piece in the regulation of blood sugar in the body. This hormone insulin that is released by the pancreas facilitates the movement of glucose sugar from the bloodstream and into the cells of the body. The cells then use the glucose as energy to maintain normal daily function of the various parts of the body. As the glucose is moved into the cells, the circulating glucose level decreases. When this level reaches a predetermined low level, the body triggers the need to eat. In turn, the blood sugar levels rise again. This rise in the level then triggers the release of more insulin. This cascade of events does not work properly for those that suffered from diabetes, and thus the levels of circulating sugar remain unchecked. Longing to find a type 2 diabetes prevention plan, one must look at the type 2 diabetes risk factors that lead to this condition. As stated above, obesity and inactivity are major causes that can be addressed and corrected if the individual is so motivated to initiate a type 2 diabetes treatment plan. However, there are a few types 2 diabetes risk factors that cannot be reversed. For instance, race or ethnic background plays a large role in whether a person is predisposed to developing type 2 diabetes or not. Those with the highest risk include African Americans, Native Americans, Hispanics and Asians. Moreover, a family history of type 2 diabetes as well as age is unchangeable risk factors. On the other hand, those searching for ways to find a type 2 diabetes prevention plan or a way to find a type 2 diabetes treatment plan may want to consider those risk factors that can be addressed and altered. High blood pressure as well as high triglycerides predispose one to type 2 diabetes, and both can be controlled through diet, exercise and medication. Metabolic syndrome and obesity at times go hand in hand and can be handled in the same fashion. Because these type 2 diabetes causes can be altered, the overall outlook for motivated patients with diabetes improves greatly. Learn more at type-2-diabetes-causes.com.